Welcome back. Studies have shown that race and socioeconomic status can affect a person's health. And some of that information comes from a study. It's called the SWAN study. It's a nationwide deep dive into women's health now in its 30th year.
As part of Black Heritage Month, NBC 10's Latoya Edwards caught up with the lead SWAN investigator here in Boston. And as she reports, when it comes to medical research and those who provide care, representation matters.
Meet Dr. Sherri-Ann Burnett-Bowie. Her journey to Mass General Hospital began in a tight-knit community of Brooklyn.
It was like being in the Caribbean. When I was 8, we actually went back to Barbados, and I was there until college.
Wow.
Came up Harvard undergrad, Pittsburgh for medical school. Growing up, I was always surrounded by healthcare,
including a mom and many aunts who were nurses.
SWAN study started when I was in medical school. We needed to have a longitudinal study where women were enrolled in the study before they entered menopause. We're asking women about their quality of life, about their sexual functioning, urinary symptoms, your bone health, cardiovascular health, social stressors, discrimination.
In 7 sites across the country, including right here at Mass General, half of the cohort is white. The others come from diverse backgrounds.
You'll hear us talk a lot in SWAN about black-white differences because those are where the greatest disparities tend to occur. Through SWAN, we've seen that our black women have menopause about 8 months earlier, and earlier menopause is also linked to increase in cardiovascular health concerns.
On top of that, decades of data shows black women come in with higher rates of diabetes and
higher body mass index, lower good cholesterol, higher bad cholesterol, hypertension, again, things that set you up for poor health. Having regular physical activity impacts all of those challenging health outcomes. If you have multiple jobs, when will you exercise?
To get to where you are right now, you had to, I'm sure, experience microaggressions. Can you share any of that? Being
assumed to not be the physician, I don't make it something that brings me down. That's a lifetime of professional journey to get to that point.
What do you want a woman who's sitting cooking dinner for her kids, she looks up, she's here, she's speaking, what do you want her to be curious about?
More than anything, I want that amazing woman who you just described to pause and make sure she's doing everything to put herself first.
Do you feel like a game changer as a black woman physician?
It is very hard for me to say yes to that. I don't like to frame myself the way how you described.
As a game changer?
Yes.
But you are a game changer. Yes.
I will appreciate the gift of you saying that.
Right.
In addition to being the lead SWAN investigator at Mass General, Dr. Burnett-Bowie chairs the hospital's Diversity and Inclusion Board and is an associate professor of medicine at Harvard Medical School.